patients come, they do education. This is our cooking demonstrations, along with an exercise session. So our cooking demonstrations, we currently do 11 sessions per week. We have Chef Mark. He teaches them, we use the Pritikin program. He teaches them actually how to prepare the food at home. We allow, in our program, for the patient to bring their caregiver. So it could be their spouse, it could be their child, it could be their sister. So we really want that whole home environment to change. And kind of the cooking demos, we put those on Friday. That's kind of our big hoorah for the week. And what you just saw there was our graduation. When people graduate, when they finish the program, we get on the mic, talk about them, we roll out the red carpet, they walk the red carpet, they sign our gong, and they bang it. So, and actually just this week, we had a gentleman get out of his wheelchair and walk the red carpet. That was his goal. So in the past year, last year I introduced our intensive cardiac rehab. We opened in March of 2016. So we had just been open a few months. It's been very successful. So I just wanted to share with you what we've done in the past 12 months. So since last July, we've done 1,050 initial evaluations. When the patients come to us, we spend 2 hours with them. We do a complete medical history, what we were talking about the importance of today. We assess things like how they currently eat, how active they are, their quality of life. We do a depression screening. Then we do all their medical history, see their medications, are they compliant? And then we also do an exercise tolerance test. In our facility, we're able to accommodate anybody. We can do a walk test, we can do an arm ergometer, we can do, which is an arm bike. We can do a new step, we have a treadmill protocol, we have a bunch of different protocols. So we can take anybody into our program and assess them and see where they are. Again, if you're not familiar with cardiac rehab, we hook them up to telemetry. So that's what makes it, it's monitored so we can see how their heart's responding. We've done 4,500 cooking school patient sessions. Again, I said this is kind of the highlight. We have a great chef that comes in there. The Pritikin program is low sodium. It's no processed foods, no sugar, and then it's pretty low in animal protein. And being a dietitian, I didn't really think that would go over well down in the Deep South, but I've been amazed at how the patients are really adapting to eating this lifestyle, and they get the benefits. We've done 268 one-on-one dietitian consults. My team is made up of coaches, is what we call them. They're exercise physiologists and nurses. I have a registered dietitian. I have some medical assistants. I have a therapist. So Casey meets with all of our patients, like if they have A1C over 8, if they have any other comorbidities, if they have renal failure. But how it typically works, they're with us 2 hours. They get education and exercise every time they come. It's 2 to 3 times a week for 12 to 18 weeks. So usually by the end of the program, if they meet with her, she says, they're eating better than I am. So it's really, the program is very comprehensive, it's very inclusive, and I think that's what adds to our success. We have done 17,213 cardiac rehab education sessions. So on our Mondays, we do workshops. Casey, our dietitian, will teach workshops on label reading, on low sodium foods. She brings in objects, she brings in the demonstrations of the foods, where you can buy them. Then we also have a therapist. So he works on the stress reduction, the depression, the time management. When we do the therapy, we call it Healthy Mind sessions. He puts the chairs in a circle, they all wear name tags, and they really start to share their story, and they become their own support group. Our patients pick, like I said, we have 7 groups a day. They pick which time works best for them, and they come at the same group every week. So then they all become friends, they become friends, their spouses become friends. It's a whole little get-along gang. But it really helps them, I think, to recover through this process. We've done 18,640 cardiac rehab exercise sessions. So every time they come, their coach has written an exercise prescription predicted off of that baseline of where they were and how we titrate them up. We always do cardio. They work through all the machines. Monday, we do a lot of resistance training. That's our strength day. So we have a beginner and advanced strength class. So the beginner class is all the sternal precautions, usually in the chair, like Dr. Murphy said yesterday, even just with 2-pound weights, bands, ankles. You know, if the ones are in a wheelchair, they stay in their wheelchair. And then we have advanced. It's up on the weight room. We have dumbbells to 100. I haven't seen anybody lift those yet. But Friday, it looked like Gold's Gym up there. One of the coaches had 6 men rotating. They were doing curls and shoulder press and all this stuff. And what we've really found is the men really love getting their upper body strength back again. We even do a lot of ab work and core work with them too. And then on Wednesdays, we bring in a yoga instructor. We call it balance and stretch. When we say yoga, they're not too keen on it. They don't want to do it. They think they're going to hug trees or something. But this really helps them work on their balance, on their flexibility, and it really helps bring their heart rate down. So we make them go at the beginning. If they absolutely refuse, we'll let them go away from that. And then on Fridays, along with the cardio, we try to include some functional movement stuff. So it may be picking up a box. It may be pretending like you're carrying a gallon of milk around the track. It may be pushing something heavy. And what we're starting to incorporate, too, is teaching the patients how to get up off the floor. That's a big functional movement thing. They want to get in floor and play with their grandkids. They're afraid if they fall, they won't be able to get back up. They want to play in the flower beds. And it'll also help us with our yoga to be able to do some more things with them. So in all, in the past 12 months, we've done 37,212 total sessions. So with this volume, this makes us the busiest intensive cardiac rehab in the country currently, which we're pretty proud of, and we're busting at the seams. So this is a patient of ours.
It was ranging anywhere from 246 over 140 was about my average when I first started. Today my blood pressure was 132 over 84 after exercise. I have lowered my A1C from 10.4 to 7.5.
Wow.
I have lowered my cholesterol from 24 points total and 34 points on my LDL. I've increased my 6-minute walk by 300 feet, and I've lost 8 pounds. Don't give up. Even if you have blood pressure issues and you can't work out, don't give up. They'll work with you and you'll get it.
This sweet patient, she used to come in, anxiety's high, depression's high. She would just cry while she's on the bike. She was terrified. We also, during her program, we had to send her to the ER 2 to 3 times because she'd come in and her blood sugars were close to 500. So you can see her progress. She's came a long way. One of the things that we do in our program is we case manage. So what that is whoever meets them on their first visit sees them through the entire program. So they have their coach. So this is Thomas with his patient, and they really get to know them. So what we always tell the physicians is, we're your eyes and ears. We notice if there's a rhythm change, because we see them 3 times a week. Their blood pressure's up. A gentleman Friday came in, he gained 5 pounds since Wednesday. Okay, we're sending downstairs CHF, see what's going on. We gotta get some fluid off, because if we let this go to Monday, we're gonna have problems. So this is, when we talked to her, she was boo-hooing. She couldn't even stand for 5 minutes, and now she's back to care for herself. And I don't know if you can tell in the picture, she is on oxygen too, 24 hours a day. So here's another one. He's in his graduate t-shirt. He came in my office and thanked me for the program. Again, the coaches and the dietitians and everybody are doing all the work. But he thanked me. He said he feels like he's a teenager again. His energy's so high. He said his wife had been on him for 2 years. He even joined a gym. He only went 2 weeks, paid for it for the entire year, never went back. But he got great results. That's him with Lauren. That's his coach. And she's a big hockey fan. She actually turned him into a hockey fan too. So, and then another one. He's our rock star so far. He lost 57 pounds. He holds the record in our clinic. And he says he feels like a changed person. His wife got great results. She had lost some weight. Their whole household had changed, kind of their lifestyle. And he's back to able to work again and do his labor job that he had been off of for a few years. So because this works, I know everybody cares about numbers. Of course, blood pressure goes down and A1C improves and all the health outcomes. But it's the quality of life. That's the real thing that I love about this program and about what we can do for all these Arkansans. So we know that it works. We know that the patients love it. So let's hear what the physicians have to say.
We know that exercise helps people keep their muscle tone after surgery, improves appetite, and gives you the feeling that you're getting well. This program includes exercise as well as nutrition, another interesting part, an important part of recovery from surgery. The motivational part of this program is another part. There's a fair amount of depression after heart surgery. When people are physically down, they frequently get mentally down. This motivational part, I think, will help people get through that. And it'll also be someone to explain to them that this is not unique to them, that it happens to everybody.
Exercise itself is incredibly important to everybody, but perhaps more importantly to people with heart disease. The level of fitness a person achieves in middle age is a major determinant of how long that person will live and how much quality of life she'll have later on. In patients with heart disease, being part of a structured exercise-based program has been associated with almost a 50% decrease in heart-related deaths and at least a 30% decrease in all-cause mortality. There are very little things in medicine we can say that have such a deep impact in the patient's outcome. In addition to that, we include other components. We do a lot of education relating to the control of risk factors for heart disease. We help patients stop smoking. We help them control their diabetes and basically regain some of the confidence in themselves that they sometimes lose after a heart attack or stent procedure.
it works, because it's good, because the quality of life is improving, we're improving outcomes. Hopefully we're keeping these patients out of going back into the hospital and having a secondary event. And because we're busting at the seams and we're almost to our capacity in our office here, in our clinic here in Little Rock, we're expanding. We're coming to a city close to you. Everywhere where you see the Strong Heart symbol, over the next few years, you'll start seeing another Strong Hearts clinic. So we want to come to you. We want people to refer in. You don't have to be a heart hospital patient to come to our program. Any provider can refer in. And we also, we're going to expand and come to these locations because we want to make it easier on the patients. Because travel time is usually typically hard and it's one of the largest barriers. So we want to go out to the patients and improve the health of our Kansans. Thank you.